Okay, so I did my project on why medical marijuana should be legal in all 50 states. When I was first thinking about this topic, I wanted to know why marijuana was ever made illegal in the first place. So it was first introduced in the US around 1910. Because it was foreign, there was a lot of exaggerated rumors about its effects, and for the most part, people were just kind of scared of its introduction to the US. In the 1930s, the head of Federal Bureau of Narcotics, Harry Anslinger, fought for its legalization on grounds of his own personal gain and racism. Some say he illegalized it so his new department would be more publicized and look more useful. He also claimed that when minorities used the drug, they would become violent and, quote, make darkies think they're as good as white men. He also thought that smoking marijuana would make white women sleep with black men. So, what I'm really trying to get at here, before we even get into the benefits of using marijuana medicinally, is that the very basis of marijuana's illegalization is flawed and based off of racism. Although the federal law states that possession and use of marijuana is illegal, which is the Controlled Substance Act, individual states have legalized it. So 36 states have legalized the use of medical marijuana. The first state was California in 1996. So some states have recreational legalization, while some states have no legalization whatsoever. I think this really limits some people's ability and access to using marijuana medicinally because some people can't really move out of their state, whether it be financial issues or things like that, to get access to that. So I think the big gap between legalization would be solved by just having the federal government legalize all medicinal use, and I think it would benefit a lot of people's lives. So California's legalization of medical marijuana did clash with the federal law. So that case was called Raich versus Gonzalez. That was in 2005 when the Drug Enforcement Administration, also known as the DEA, seized medical marijuana from a prescribed patient in California. So the patient and other patients that used medical marijuana went on to sue the DEA because it was legal in the state. So in this case, the 10th Amendment and the Supremacy Clause really contradict one another in the lawsuit. That's because the 10th Amendment states that the Constitution delegates police powers to the state, but the Supremacy Clause says that federal powers trump state laws when there is a conflict. So ultimately, the Supreme Court ruled in the DEA favor and said the federal government succeeds in state law. However, the federal government rarely enforces it. The only instances where the federal government gets involved is really with criminal and illegal distribution of marijuana, but rarely with the medical use of it. So, actively seeking out users of a low level drug takes time, money, and resources. And if no one's doing it, why is it still illegal for medical marijuana? Some of the positive side effects of medical marijuana is that it helps with pain management, specifically things like arthritis, fibromyalgia, and endometriosis. It also helps with cancer treatment, so it helps with the loss of appetite. It also replaces long term pain management like ibuprofen, which, when that's used long term and daily, it can cause gastrointestinal problems, kidney problems, and even heart failure. It also helps with reduced inflammation, so any inflammatory diseases like Crohn's disease, IBS, and rheumatoid arthritis, it really benefits and helps people with those conditions. It also helps with neurological disorders, so things like epilepsy, multiple sclerosis, Parkinson's disease, and Tourette syndrome. Also helps with sleep management, like conditions like insomnia. Some specific cases where using medical marijuana has benefited their lives. The first being Rebecca Sewell. She was diagnosed with complex regional pain syndrome at 10 years old. So, CRPS is referred to as suicide disease because of the high intensity of the pain level, which did cause her to have to use a walker. So, after many failed treatments, she did begin using medical marijuana, she no longer had to use a walker, and she ended up removing her morphine pump. The next is Charlotte Figi, which she is pretty well known. She has a documentary kind of about her experience. She was diagnosed with Dravet syndrome at 3 years old. It's a form of epilepsy, and she had around 300 seizures a week, which caused her parents to decide for her to go into a medically induced coma because of how much pain she was going through and how many seizures she was having. Then they decided to have her start using a form of cannabis oil, and after she started using that, she didn't have a seizure for a whole week, and it continued to decrease the amount of seizures she had from before. The next is Vivian Stagg. She began having seizures in her later years, which prevented her from doing her job, which was a bus driver. So she did start taking medications, but she really didn't like the side effects, and the doctors ultimately said that the only form of relief was through an intense, invasive, and dangerous brain surgery. She decided against it because of the high risks that it showed, and she started using medical marijuana, and her seizures decreased, and she was able to know when they were coming on and kind of manage that, and ultimately she did get to go back to her job. The next is Sadie Higuera. She was diagnosed with Schindler-Guyton syndrome at 3 months, had 300 seizures a day, and was put on many medications with extremely strong side effects. Doctors said her last option at survival was a medication that could have also potentially ended her life at just 1. She then started using medical marijuana, and her seizures decreased, and she ended up living 3 years past her expected lifespan. So all these cases just represent so many more cases in the world. There's many instances where there have been benefits similar to these. So let's talk about some of the negative side effects, because it's important to look at both sides. So some of them is hallucinogenic, which is obviously kind of having hallucinations. Prevents the ability to do certain things, so it's harder to do motor skills, and you lose coordination with certain uses of medical marijuana. It can cause kind of depressive feelings, so the calm and relaxed state can also bring those feelings. It's also stimulating, so can cause high blood pressure, mood changes, and fast breathing. And then in certain instances, there are visible signs, things like bloodshot eyes and dry mouth. So this is my rebuttal to medical marijuana's legalization, because there are some worries and concerns about the legalization of marijuana that I think are important to be addressed. So the first is medical marijuana can be used as a gateway drug for stronger drugs. While this can be true in some cases, research shows that most of the time when this does happen, it's actually minors who are using illegally and recreationally, mainly because they're chasing some sort of high and not a relief from severe symptoms, which leads them to find stronger drugs. Some people may be abusing the prescriptions of medical marijuana for conditions that can't be proved. So, for example, things like anxiety, insomnia, chronic pain, and migraines can't necessarily be proven. So some people think that if medical marijuana is easily prescribed, people can use one of these conditions to gain access for recreational use. A way that we can solve this is just to make tighter restrictions on prescribing it and only use it for more severe conditions. The next is that medical legalization makes marijuana more easily accessible to minors and those who want to use it recreationally. Again, a solution for this is just to tighten restrictions and monitor the production and distribution of medical marijuana to prevent that recreational access to minors who do have a stronger chance of addiction and abuse. The last is that it could potentially encourage people to grow marijuana on their own for their own profit. Regardless of whether or not any type of marijuana is legal or not, people will still illegally grow and sell marijuana no matter where you are. So ultimately, this could be stopped by just a focus of law enforcement to stop those activities. So let's just look at the statistics. So a survey done by the Public Department of Health in California in 2013 found that 92% of medical marijuana users said that the use alleviates their symptoms of serious conditions. The same survey also said that 8 in 10 doctors approve the prescription of medical marijuana. So it is backed up by science and doctors who have gone through a lot of schooling and kind of seen those effects. It also said that 24.8% fewer deaths from opioid overdose in states where medical marijuana is legal. An estimated 2 million people in the US are addicted to opioids. So this has a lot of significance because medical marijuana can replace addictive painkillers like oxycodone, which is an extremely big problem today. So legalizing medical marijuana brings that number down and could also prevent more people from getting addicted. So on kind of the opposite end, there is an estimated 9% of people who use marijuana that become dependent on it. Now, this is true, but you also have to think that every drug has the possibility of addiction and dependency. And if we're going to keep this comparison of opioids, they have an estimated 20% addiction possibility. So if we're thinking of some things medical marijuana can sometimes replace opioids, the benefits outweigh the costs. And also, when prescribing and using medical marijuana correctly, it's a very useful tool. So ultimately, I do think that legalizing medical marijuana in all 50 states, there's more pros than cons. And I think it could help so many people and give people access to relief and help with their pain management. And I think it's just a really good option and a good tool that can be used to help people. So these are my 2 pages of citations.